Hello, my name is Amy Sturkey. I am a pediatric physical therapist, and I'm here with my co-instructor, Bode, who's just out of the room for the moment. And I wanted to talk to you today about torticollis. This is the fourth in the series of four on total motion release and thinking about how, from this perspective, you treat torticollis. So typically a child who has torticollis has tightness on one side of their neck, making them tilt that way and rotate the other side. But it turns out that these kids, most children with torticollis are left torticollis. They have that left side tight, looking to the right, that whole side is tight, which affects their whole body. So you shouldn't just look at them from the neck perspective. You have to look at their whole body. And so what they do is they look at set motions, and they look at them on both sides, and they figure out which side is harder. And for most physical therapists, if you had a muscle that was tight, you'd stretch that muscle. That's how you work at it. You'd stretch it, stretch it, stretch it. But in total motion release, the way they work on it is they work on the easy side. They take the movement, whichever side is easier, they do that one, and they let the muscle relax on the other side, and then they retry the movement. So that doesn't make much sense, but if you think about a finger cut, if you try to stretch those fibers, they get tight and they contract, and I can't get my fingers out. And the only way you can get your fingers out is to shorten that so that it relaxes and you get your finger out. The more you stretch it, the tighter it gets. My fingers are caught. The more you shorten it, the more they can relax. So we're trying to relax muscles that are way too tight by shortening them. So the last movement that we're going to do is the lower twist. So we're going to get Bode and we'll do these. Let's do it. So on this movement, it's a lower side twist. So if he had left torticollis, I would expect his whole left side to be tight. On this one, if you bring it up that side, you're expecting him to be able to rotate his hips to his right easier. So let's see how far this side goes over. And we're comparing the two sides. Whatever you do, compare the two sides. Looks like he goes this way easier and that way harder. So whichever is the harder side, you don't do that side. You do the easy side. And you hold it. Now, every baby is going to be different. So you're going to look at your baby and see which one is the easy side and which side's the hard side. Now, it might be that your baby can do both sides even. You don't have to do this at all if your baby is even on both sides. But if they have one side that's easier than the other, do the easy side. Hi. And after you try the easy side, go back and try the tricky side. Whoop. Oop, it's still a little bit tricky this way. Let's go back. Do the easy side. Try to relax those muscles. So you're holding the opposite shoulder and bringing that hip over. Boop, 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 boop. Now, the research that Susan Bloom has done says that most babies twist to the left easier and rotate to the right on their lower body easier. So upper twist left, lower twist right. It's the opposite. So sometimes you can do this for just 10 or 15 seconds. Sometimes you need to sing a song. I'm trying to see. So this side is harder. So I'd recommend his mom practice this side, hold it longer, and see over a couple of minutes if you hold it, if it made the other side better. Whoop. Clearly, this is not long enough for Bode. I'd have to hold it longer. But that's the crux of the idea. I hope this is an easy idea that you can do to work on thinking about these postural restrictions in the body. Because the research says if you do this total motion release type of work, that the time in physical therapy to treat the torticollis is decreased. You're less likely to have the problem come back again. and they have more symmetry in their gross motor skills. So it's a really effective way to work on torticollis. I hope this is helpful, and we'll look forward to seeing you next time. Thanks a lot. Bye-bye. If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.